Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
Galen Myotherapists are 100% dedicated to choice-led treatment.
Welcome to Petability. I'm your host, Kathy Simon, certified veterinary technician, certified canine rehabilitation practitioner, and certified hospice and palliative care technician for pets.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Hey, Kathy, how are you today?
Hey, Chris, I am doing fantastic this week. Would you like to know why?
Of course.
It's my favorite time of the year. We're recording today on October 16th, 2025, and this is National Veterinary Technician or National Veterinary Nurses Week. It's a full week to appreciate veterinary technicians, and I feel the love.
That's great. I do appreciate you every single day. Not only for the skills that you possess and your vast knowledge and what you impart to our pet friends, but I value you as my friend as well.
Thank you, Chris. I value you as my friend too. And I hope I don't get emotional here when I'm talking about what it has meant for me to be a veterinary technician over the last 35 years. I was thinking about making a post about this on our social media account, and it was so difficult to put to words what it really means to be a veterinary technician and all the things that I've done and all the things that I do for patients, but also the things that patients have done for me. And it struck me because I have a patient who I love very much. It was this cat named Rusty. It was an 11-year-old cat with FIV, and he had a lot of medical complexities. And so I was managing him in his final stages of his life. And I was sitting with him thinking, how fortunate am I that I got to share in the life of this cat? How fortunate am I that I was honored to know him and to be with him in his final stages of life. And he just loved everyone. And he was so sweet and just, ways that, I feel like I was healing him. And in often times I feel like he was reciprocating and healing me. And there's never going to be an opportunity for me to say everything that technicians do, right? But just the gift and the honor that I've been given to take care of animals and is amazing, and it's definitely a calling. So I'm going to try not to cry about that, but yeah, it's been a fantastic week, and I do appreciate everybody saying that they appreciate me and my work, and I appreciate veterinary technicians globally and veterinary nurses globally. So we're the glue that holds it all together. But man, what an honor. What an honor.
I don't know how to pivot here smoothly because that was.
How do you follow that?
Yeah, right. Thanks, Kathy. But I just did want to give a heads up to our listeners and maybe people that feel like they know me a little bit, because about 3 weeks ago, my Baxter had cervical spine surgery. He had been having pain for about 2 months, wasn't getting any better despite all the things that I was doing. Took him to see my favorite neurologist, Dr. Gina Silver. And she did surgery that day, and he came out of surgery a new man. He had no complications. He came home the next day. It's a major surgery, a ventral slot surgery, and he did great. So we did repost the IVDD, intervertebral disc disease episode where we interviewed Dr. Gina Silver years ago, and put that back up 2 weeks ago because it was front and center in my life. So I will keep you posted, but he's doing quite well.
Excellent. And Dr. Silver is one of my favorites because she's so talented. So if your pet has IVDD, I would take a listen to it. There's lots of good, relevant information there.
So what are we talking about today? Let's get to some more good, relevant information.
We have a great guest today, Chris, certified Galen canine myotherapist, Lisa Buchanan. And I met Lisa through our work with Medco Vet. As Chris and I have mentioned on the show before, Medco Vet is one of our proud sponsors. And Chris and I do some consulting work for that company as well, because we believe so strongly in the Medco Vet Luma and the company Medco Vet. And Lisa and I got on a call and started talking about, how to incorporate the Medco Vet Luma into her practice. And I could tell right away that Lisa was one of our people. It was a really great conversation about her approach in respect for each dog's individuality, emphasizing their physical comfort and their emotional well-being. And this aligns perfectly with our philosophy of treating animal patients. You and I wholeheartedly believe in treating our patients as a whole, body and mind. And caring for an animal patient is both an art and a science, right? It's blending your practical tools, like your hands-on, your body work, exercise, incorporating mobility aids, but with a really deep understanding of a dog's emotional and physical needs. So just as every dog is unique, so is your approach to maintaining their mobility and quality of life. So I'm really interested to hear more about Galen Myotherapy and how Lisa incorporates this into her treatment plan and what that looks like. But let me give you a little bit of background on our friend Lisa before we get started, okay? Lisa Buchanan is a certified dog trainer and a certified Galen canine myotherapist and a level 1 Reiki practitioner. And she embodies the holistic, choice-led philosophy centered on training, pain management, and mobility. And Lisa completed her formal training with Galen Myotherapy UK, a globally recognized leader in canine myotherapy education. In addition to myotherapy, Lisa integrates her background in animal training, energy work, and science into her approach. So please welcome to the show, Lisa Buchanan.
Hey, Lisa, thanks so much for joining us on Petability.
Hey, it's so great to be here. Thank you for having me. I've been really excited and looking forward to this.
Lisa, can I tell the audience that you divulged that you're a super fan of Kathy and me?
Yes, of course you can. That's why I'm so excited. I feel like I'm almost a bit of like a Petability stalker. When there's a new episode, I get so excited, even when there's a rewind episode.
That's great. So Lisa, let's get into it. Tell us and our audience, how did you first discover Galen Myotherapy? What exactly is it for those who haven't heard of it? And why were you inspired to make it part of your professional journey?
So I am not like most probably dog trainers or canine support individuals. I did not grow up in a house full of dogs. I grew up in a house where my mom did not want dog hair everywhere. She tried to have a dog a couple times. That didn't work out. So I was a little bit later in life to my introduction to the really profound relationship that you can have with a dog. So I was introduced a little bit later to that relationship, and a few years ago, we were getting a new puppy, and my kids were finally a little bit older, so I thought I'm going to learn how to train this puppy, and realized how much the world of dog training had changed over the years, and how much was available online, and I really kind of geeked out on psychology and behavior, and having a background in nursing. I'm a human nurse. I think probably also helped with that. And so I got really interested. And then I started, it was post-COVID, and I was looking to do some volunteer work. And it was just the spring, actually, when all the poor COVID puppies were in shelter, and I started volunteering at the shelter. And from there, I felt like there was more that I could be doing when I was walking the dogs. And one day, this is my inspiration for basically everything that has followed. There was a dog in shelter, and the dog's name was Baz, I remember. And Baz was a border collie, and he had come in really, really reactive. And I don't know the history to this day. Anyways, he was in shelter for a few weeks, constantly with signs in the door saying, don't walk this dog if you're a volunteer, don't walk the dog. And then one day I said, so is he settled a bit? Like, is it okay if I take him out? And I had been there for so long, they trusted me and said, for sure. So you can take him out. So I took the dog out and we went for a great walk. And this guy was just so super attentive to me. I was a little bit on guard, not knowing sort of his history and why he had been so reactive when he came in. And then I thought, I'm going to try something. I sat down on a park bench out where I walk the dogs, and Baz hopped up on the bench beside me. And I was like, oh, aren't you a sweetie pie? And then Baz licked my face. And I went, oh my gosh, this is the loveliest dog ever. Like, I would just love to take this guy home with me. And this is where the sad part comes in. I went back a week later and Baz had been euthanized. Again, I don't know the reason. And that sort of is where the story takes a turn for my life. So Baz was the inspiration for anything I did after that. I decided that I needed to understand more, to know more, either to know more so that I could understand what it was that I didn't see in this dog that the behavior consultant or the behavior specialist did see and felt this dog was a danger to society. And so I went on to do a year of study in dog training and write a board exam with the CPDT in the US, even though I'm in Canada. And then, of course, I finished that. And this is while I was working with nursing students and, supervising clinical placements and things like that. And then I decided, oh, my goodness, I understand the behavior and the training of dogs. But through that year, what I realized was, how could I possibly train a dog if I can't, or help a behavior issue if I can't tell if a dog's in pain? So one of the things I learned was, really looking at the dog as a whole spirit in this world, right? The body, mind, and the spirit. And sometimes we don't add that spirit part. And any of us coming through COVID, we really understand, just the cognitive, but also the mental and spiritual well-being that we need. And so that started my journey to try to find, how could I really learn what I needed to know to tell if a dog was in pain and to maybe help those dogs. So my background, not being in the veterinary, unlike Kathy as a vet tech, and Chris, correct me if I'm wrong, but Chris, you were a human physio and then moved into canine physiotherapy, is that right?
Correct. Yep, I'm licensed and
right.
PT for people.
So that was an option for you. Being a human nurse is amazing and it gives us lots of opportunity, but we are one of the professionals that cannot cross train in equine or canine. And so any of the programs I looked at that looked really fantastic, you had to be either a vet tech or a vet assistant or a human physio or a human massage therapist. And so I was listening to another podcast and heard a woman named Julia Robertson speak. And Julia is the head of Galen Myotherapy. She started Galen in 2002 in the UK. And I was really inspired by a story she told about a dog she had back over 20 years ago, that the young dog, I think a fairly young puppy, and she had been told that she was going to need to put this puppy down. And essentially she found a vet who did, I think my understanding is, some sort of a chiropractic type of adjustment. And the puppy, it was one of those miracle situations. And the dog was totally fine after that, no other issues. And holy cow, did she ever feel like she had dodged a huge, huge bullet with this puppy. So I started looking into Galen Myotherapy and realized the way that she had put this program together was so that anyone from any background could take this program, and depending on what your background is in, you could enter through different pathways. So if you had no background in science at all, she has a pathway where you would do all of the work down to like the cell biology level. And then myself, being a human nurse, I could enter in a pathway that, I didn't need all those sort of high school biology type of basics, right? But I really wanted to understand a lot more about canine anatomy and physiology. And I needed that in order to understand anything about functional movement. And the science of where I'll never forget when I realized where the scapula is on a dog. I've never thought about it before. And then the other thing that attracted me to Galen Myotherapy was that it is grounded in Julia's philosophy, and that is a trademarked or something called positive pact. And essentially it's that Galen Myotherapists are 100% dedicated to choice-led treatment. In order for someone to be in a position where they can heal any sort of a mammal, their nervous system needs to be in a relaxed state. And as a human nurse, I saw that so many times with patients as a mom of kids, as just a person, an insightful person myself, I really feel that we need to be in a state of calm and well-being in order to do any sort of healing. And so positive pact really seemed like the gateway to that.
So the technique that you're using, or the method that you're using, is PACT, correct? It's positive, progressive, effective cycle of therapy. Correct.
Yes.
Okay, great.
Yes.
Yeah, maybe you could explain a little bit about what choice-led mean, because when you say that to me, it makes me think you're treating intuitively. You're treating and listening to the body of the patient and allowing them to have autonomy and choices. And so can you just go into that a little bit more?
Yeah, that's a great question. And I will say my view of it my perspective has changed. And so choice-led things to me used to look like, if I trained a dog to be okay, to do something and to let's say lay still, then and they stayed there, then that felt like choice led. What we're actually doing with Galen myotherapy is, to me, a whole other level of that. So there can be an element of intuition with this. What I would say, though, is I would never want to rely on my intuition telling me. So I do look for there are very physical indicators. So what a Galen myotherapy session would look like is, I wouldn't touch the dog, like put my hands on the dog, until the dog came to me. And so what the session looks like, and also too, I wouldn't touch a part of the dog that the dog wasn't exposing to me. Many dogs have not been given many choices in life either. And so they're not necessarily, they don't understand the concept of what we're about to do. And so what we do is we create a treatment area. So what I do is I have like a PEMF mat, and then I put either a yoga mat or a blanket that the family has that the dog likes on top of that. And then I make it really so that's clearly defined, the space. And it can vary in size depending on the size of the dog. And then I would just sit by that space along, if possible, the guardian for the dog. And so ideally myself and the guardian are sitting over by this space, and we can encourage, tell the guardian, you can encourage your dog to come here. And if the dog chooses to come there, great. If the dog stays there, and then there's a slow incorporation of touch then. And so the dog is allowed to come and go freely. And I have had dogs that will literally come to the space for 3 minutes, and you feel like you're really getting into something, and then they wander off again. And then they come back. But the idea is that we are giving this very sentient creature the respect to know that they know what they need in that moment. And that they will come to get what they need from me when they need it.
Dogs are encouraged to guide the pace and the intensity of their treatment with reinforcing the trust-based cooperative dynamic.
So well said. I love talking to people who do cooperative care work with all kinds of body handling, like nail trims and things like that. And so, so I think it is part of probably what really is a global movement. And we've got some different names for it here and there, but the concepts are the same.
It's not just not imparting something negative, it's giving them free will and choice to make something positive.
The science is there to support the fact that healing happens most effectively when the nervous system is relaxed. So for listeners, who aren't familiar, when I say nervous system, what I'm referring to is that your body has a sympathetic nervous system response and a parasympathetic nervous system response. And the parasympathetic one is where the body's in what we call rest and digest mode, which, Chris and Kathy both know really well. And that means that, we've got good blood flow, our heart rate is regular, we're breathing a little more slowly, all those things are happening. The opposite of that is when that sympathetic nervous system is activated. And that's the layman's term for that is the fight or flight mode. And so when our dogs are nervous, And that may show up as very subtle signs like, a little bit of lip licking, or, it could be the dog that's, barking at everything that comes into the room and can't settle. And so in order to get those dogs into that healing state, that's why choice is so important, because any mammal that feels cornered, their body is going to naturally enter a state of fight or flight, and we are going to really activate that part of the nervous system that we want to relax. And so that's why this is really, really important and different. And that's the other reason too why I do a lot of work with helping guardians to do the work themselves and to make changes in the home and the environment to support the dog's well-being and physical confidence.
I love that as a profession, we've moved into using words like pet parent or guardian versus owner, right?
Mm-hmm.
We own this dog or we own this cat. Even the language is just so much softer and nicer than it used to be. And I think you're absolutely right. I mean, nothing is better, I think, than when you have a patient that you've gained their trust and they fall asleep during your
and their tongue's hanging out.
Don't be offended if they fall asleep and the drool's hanging out. But really, I think that's the best healing state. It's the best state for healing. You're right.
We've established this concept of choice-led intervention therapy, but we really haven't gotten into the other facets of it, which to me are fascinating in terms of the physical. Like, what is Galen therapy? What are you doing? I was looking at the Galen website, and it seemed, that it's a huge hands-on muscular, which I assume also includes fascia. We're learning more about the role of fascia. And, and then I think, well, there's a whole bunch of canine bodywork concepts out there. There's massage. We as physical therapists, do a lot of manual therapy. There's chiropractic. So what is unique about Galen Myotherapy? What exactly are you doing in a session, Lisa?
So with Galen Myotherapy, one of the things to understand is that it is a program that is 100% completely grounded in canine physiology. It's not borrowing things from humans, from human practice. It's not borrowing things from equine practice, which a lot of programs and things you look at are, they look at they'll offer a canine and an equine program or something, or they'll do it as a combination. And Galen is 100% focused on canine anatomy and physiology and research and that evidence-based practice from that perspective.
Yeah. I did want to ask you, this is canine specific, no other species, correct?
You got it. It is canine specific. So while, if you talked to Julia, who started the program, I think she has worked on many, many animals. I've heard of other therapists, working maybe, with rabbits and cats and things, but the program, what I practice, what I've been trained to do, she's got over 20 years and she's breaking new ground all the time. She can work on rabbits and chickens if she wants to. Well, my focus is dogs. Yeah.
Yeah, well, I was going to say, and I think we extrapolate to those other species because we don't have specific tools or programs for them. There are so many species out there. So we do take what we know and we do borrow things many times and apply it across species. But I hear you in what you're saying, that this was developed specifically for canine.
So what we do as a Galen myotherapist, we do look at the whole dog and from a very canine specific lens. So for example, one of the first things that I will do is I will send somebody if a client reaches out, and I do this is complimentary for anybody who's interested. Galen has a comfort scale. And so what has been put together for therapists by Galen Myotherapy is a measurable list of observations that we would ask a potential client to take a look at. And over the course of the week, rate whether they're seeing a certain behavior or not seeing a certain behavior. And so those behaviors might be things like, have you noticed that your dog has stopped jumping onto the couch and they did used to do that? Does your dog carry toys? Have they stopped carrying toys? And there are various questions giving us some insight into really understanding whether the dog is exhibiting any degree of pain that, as we know, dogs are really good at hiding. Their lives depend on it historically. So They're very good at hiding pain. And so this comfort scale questionnaire has been designed in order to help pet parents to be able to identify signs that as a Galen myotherapist, I might be able to put together and go, okay, you know what? One or two of these items we could write off as being behavioral thing, or it could be just having a bad day, or it could be the environment they were in, that kind of thing. But then we put it all together. So I actually have a scoring template that I use, and I can take a look at that and say, okay, you know what? Your pet fits into a category that they're probably largely doing okay. I can give you some environmental recommendations that will help you to keep your pet feeling well and moving well, right? And then there's a category where I would be able to say, you know what, your pet is in this category and they would benefit from Galen myotherapy. Let's have a chat. And then there's another category that is, your pet really needs to see a vet. And as Galen myotherapists, one of our, I think because this was developed in the UK, where in the UK, pet parents are not allowed to make a lot of decisions for their dogs. They almost everything has to be signed off by a veterinarian. And so I was trained to work very closely with veterinarians. And so I always include the vet in any of my assessment notes. They don't have to respond to me, but I send them to them so they're aware of what's happening. I let them know what we're doing. And if they said to me, no, you need to stop, then I would stop, right? So even if a pet parent said you continue, that's just not the philosophy of Galen myotherapy. So okay. So you were asking me to just talk about what's different. So one would be that we do use a questionnaire, and I've never seen anything similar to it. So I really love that. In terms of the techniques that we use, so it is a fulsome approach. So one of the things that we do is we look at the dog's environment. And so I would look at what kinds of floor surfaces is this dog moving around on, and how often in a day are they moving around on these surfaces? Are they slippery floors? Are there area rugs? What kinds of things are present in that way? Are there stairs that they're navigating? What does their day look like in terms of what they're experiencing? So I'm not just when the dog comes in looking to do body work on the dog. I'm looking at what does their home environment look like? What is their day to day, right? Because that's going to play a role not only in preventing injury, it's also going to play a role in the success of any treatment that I recommend. The second thing is the in-person component. So that's me meeting with the family and the dog and getting that opportunity to do hands-on techniques. And so the hands-on techniques really are grounded mainly in Swedish massage. So using things like effleurage, cross fiber work. We do some, lots of passive touch, passive range of motion, those types of things. So, and again, really working with the dog, and obviously looking for treating fascial tension, which is so critical. And then also just really trying to improve lymphatic flow, circulation, right? Getting those nutrients into the areas that need them. So much of the tension in the dog is typically in the neck area. So if we can start, get some movement there, that's always helpful. So, and I've seen a lot of really good improvement, even from very basic techniques. If I can get the family on board and they are comfortable even doing some treatment themselves in between, but there are 2 or 3 techniques that are so basic that if the family is willing to follow a couple of simple rules, then they can do that really safely, and they're unlikely to do any harm. And really it's good for their relationship with the dog, and it's good for the dog too. And it also helps me when I go back in and I'm doing some work with that animal as well.
Essentially, it begins with a comprehensive, 360-degree assessment of a dog, their posture, their gait, their movement patterns, their home life, the surfaces they're living on, what they're traversing, are there stairs, followed by targeted massage techniques to alleviate pain and stiffness and muscular imbalance. Would you say that kind of maybe summarizes it a little bit?
That does such a better job than me rambling on. It is, that's a great, and also too, you're right. There's a lot of photography, video, that I analyze before I do any sort of a treatment.
It's so helpful, right?
It's so helpful.
I know. And then
you can slow it down.
Right, slowing it down, because sometimes I'm like, hey, I didn't see that when I was watching, and it's really great to video. And when I'm thinking about, talking about this full assessment, I think about dogs that have chronic conditions. Osteoarthritis probably is my first thing that comes to mind because it's so prevalent in animals. But what other conditions are you seeing and treating in the dog patient?
So osteoarthritis is a huge one. Also, a lot of post-surgical works, like, so if a dog has had, a TPLO surgery, any sort of limb-related recovery, it's very, very beneficial. I find I've had clients who their dog got to a certain point in their recovery stage and then really wasn't regaining maybe the full range of motion, or they were still stiff every day. Those kinds of things also really helpful. There's a number of, I like to work with the chronic conditions. I also really like to work with puppy families. So this is one of the things I didn't get into but earlier on, but building our puppies from that early age is so critical. So talking to people and educating people about, again, surfaces their dog can be on, should be on, functional movement activities. So I do a lot of work with people too, who's, again, it's the senior dogs that either a lot of people will miss osteoarthritis. They might see a dog instead. And this is where the training behavior piece comes in. We have a dog that is all of a sudden displaying aggression and food resource guarding that they never displayed before. Or we get a dog who has all of a sudden started reacting to loud noises. I have one of those dogs living with me. She started reacting to loud noises like thunder when she was 7 years old. She's a very large breed. And we were treating the anxiety with medication and different interventions that way. And it wasn't really getting a lot better. And then over the years, it got a lot worse. And so I've been working with our veterinarian because I said, I think there's a pain component here. And so we started treating the pain instead of the anxiety. And I have a very pretty well settled dog now at this point. So that's good. It's also really beneficial. I've worked with dogs who are really nearing end of life. And I think, Kathy, that's an area that you really work in, and the quality of life that it brings to that stage for a pet and their family. I had one client dog that was not picking up their toys anymore, very elderly black lab. She's on my website, and she wasn't getting in and out of the vehicle anymore. They were having trouble getting her to veterinary appointments, and I treated her regularly for a few months, and she passed away in July. And before she passed away, she was back to picking up her own toys again. The veterinarian was really impressed and said, "Oh, I don't even recommend." They had her on some injections for pain, and she said, "I'm not even going to do that at this point." She's actually looking really comfortable. She's moving more fluidly, and she started getting in and out of the car again on her own. Nice. So we were able to bring her that comfort at the end. And again, I had a family that was, very willing to make some minor changes to the environment, add a couple of short ramps outside the house, that sort of thing. And it was just, so life-changing for them. I mean, the flip side is that family they said to me later, they said, we were really shocked when she passed because we thought, oh, Lisa fixed her. And whilst that was a lovely thing to say, it also is tough, because I'm glad that she got that mobility and that comfort and that pain relief back at that late stage in her life. But the family was just devastated because they really thought, oh, she's doing so well. We're on a different trajectory now. So yeah, I'm certainly thrilled that, again, I'm living with a dog that had become fairly unlivable with her anxiety with loud noises and things. And it was really horrible to watch and be a part of. And now it's been very dramatic, the difference. And not, there were many changes we made. So not just with Galen Myotherapy, some great supplements and things, but, dealing with and understanding what pain looks like is so critical. Understand. Right. I go back to the story I told at the beginning about Baz, and thinking to myself, oh my gosh, like, was there a pain there? There are some studies that show 85% plus of canine aggression cases, there is a pain component. And whether we can do something about that component or not with that dog, I can't say, but it's so huge, especially when you see a change. So one of the things I've added actually into my client assessments and trying to communicate to people is, because a lot of people we say, well, they could be in pain. And they say, well, oh no, my dog is not in pain. My dog was just outside running with all the dogs in the neighborhood yesterday. And it's a challenge to really try to have that conversation and convince somebody that their dog actually could still be in pain, even though they look like they're not, because they are biologically driven to push through their pain, to not appear like they're in pain. And I think, to my knowledge, working with clients and human patients that have chronic pain, what do we see with humans with chronic pain? Somebody I did a post recently on this, and I said, when I get a headache, sometimes my headaches can last for days and days, right? If they're like barometric pressure related. And when I first get the headache, I'm okay, and it's not bad enough. I don't want to take medication for it, because it'll upset my stomach or something. So I push through it. And a few 3-4 days into it, I've kind of forgotten about the headache, but the reality is it's still there. It's still nagging at me. You know who hasn't forgotten about it is my husband. He's noticed that I'm a little grumpier. I'm maybe, not into making dinner. Maybe I'm saying no to going out with friends. I'm asking for lights to be turned off. And I have a voice to use that all the people around me understand. So you can imagine when you are a dog and you can't communicate, the changes that you need, how long you could go and how long your chronic pain could continue, and sort of you just shove it into the background because you're still alive. So you got to put one foot in front of the other. And yeah, so any comfort that we can bring to that, and really just understanding that pain really can be a component at any age. So I've started to say to people, okay, let's not look at what did your dog, that's why I like the Galen comfort scale, because we don't just look at what did your dog do in this moment that I'm here doing this assessment. What's your dog been doing over the course of the last 7 days? And what did that look like? Because you know what, if something looks like super fun outside, my dog is still going to run out there and get involved in that super fun activity because it's just too much fun. It's like a little toddler boy who sees a water cooler and he's like, I'm going to push that button and let that water fly because that looks like fun, even though I'm going to get into trouble later and pay for it. Our dogs have that. That's why we love them. They're playful. They're there for us. And yeah, they push through the pain.
I do want to also say that behavior change, it can be just really subtle things. So I mentioned at the beginning of the show that my male had surgery and he's better than ever. I was talking because he's going to be staying with his Aunt Maureen for his vacation while we go away near the holidays. And she said, I wonder, Chris, if that's why he hasn't wanted to walk for years. He hasn't wanted to go on a walk.
Mm-hmm.
And I just think, well, that's Baxter. That's just his personality. But maybe it was, he's had neck pain for a very long time. They found an old calcified disc in addition to this acute disc. So yeah, or not wanting to eat. Well, now his bowls are elevated, and along with his twin sisters, and eating more readily. I know this stuff. But
yeah.
I'm calling myself out, but yeah.
And we do, and we don't. I mean, even the food bowls, that's an interesting one because a few years ago when, they came out and started saying, hey, we should elevate food bowls. Now what I have is everybody elevating them. But as it turns out, some dogs actually don't like them elevated. And so what I've moved towards through the, with my education with Galen and working with other colleagues is understanding that, maybe we should give dogs some choices and they will pick the height that is the least uncomfortable for them. And for some dogs, that height is actually a little lower than we think it might be. So that's an interesting one. When you brought it up about the food bowls, but the walks, somebody that did come up in a conversation, again, with another Galen myotherapist about that is a big one when your dog all of a sudden doesn't want to go for a walk. What dog doesn't want to go for a walk? There's got to be a reason, right? So, but these things happen so subtly and so slow. I mean, my 7-year, she's 11 now, my Great Dane Husky mix, Lucy. And at 7 is when we started seeing, this slowdown. And my husband said, oh, she's just getting old. She's just getting old. And, me not knowing anything at the time, I just thought, well, I still want to play with her. I'm not ready for her to be old. And so, so I started looking for other solutions and looking at supplements and things. And then from there, and so there is that, that idea of what understanding the behavior is really super helpful. But as it's like anything else, Chris, like if you're the person who's looking at the face in the mirror every day, it's really tough to see the changes. Mm-hmm. And it's tough to see the positive ones too, because so often, families will say to me, oh, I haven't really seen much of a difference. But then what happens is, so the way that I work is I would do the best thing with Galen is to do three appointments, because it is completely done with the choice of the dog. It could take me till the third appointment before I can do anything, substantive in terms of massage, and touch activities with the dog myself. So it can take those 3 appointments. It doesn't mean we're not doing things in between, and that, the dog isn't experiencing improvement because of what I'm doing and what I'm showing the family how to do and changes we're making. They really are, because what I've seen is where, I'll spend the first 2 appointments, and it's always a little awkward, because you're sitting there and the family's going, they're not coming over. They're not, and it's not the same as a person laying down for a 65-minute massage. So then we get to that third appointment, and something magical happens in that third appointment. And then they are able to see that, the full manual treatment. But then after that appointment, you go back and you do that comfort scale again. And that is such an objective way to see a dog's progress. You also go and you retake some photographs. And again, the number of times people have said, oh, no, I haven't noticed any change, no change, no change. And then you go back and you look and you go, oh, wait a second here. This dog had a subluxating patella, and they were walking with I'll put their hind limb, externally rotating and reaching out too far. Now they're walking, and actually they're in pretty good alignment. And then what they realize is maybe they can't see that, but then they go, oh, actually, yeah, I forgot. They started walking up the stairs again. That's interesting. I'll never forget the text message I got from one client. Her dog, they unfortunately didn't get great advice post-op for the TPLO their dog had, and they didn't incorporate any exercises or any rehab activities. And so the dog, which is a younger dog though, so good, he responded really well to the treatment with me and the activities and changes I had given them. And then they didn't feel like a lot was changing. And then this one day I went in, and again, it was like the third or fourth appointment, and finally got a really fulsome treatment. Anyways, that night I get a text message. You're not going to believe this. Molly jumped up into, my husband's lap for the first time since before she injured her knee. And he was so excited because she wanted her bedtime treat, and it just shocked him because she's a big dog and she jumped to his lap. So yeah, it's tough to see, I guess, Chris, is what I'm saying, when you're looking at it in front of you and the changes are so subtle. I love it when my family comes to visit, because they're the ones who tell me they haven't seen my dogs in several months, and they'll be like, oh, this one, she's not jumping up on us hardly at all anymore. Or this one is, she's moving better and she's getting up and down all the time, and she wasn't doing that before. So we need those other lenses, those people with other glasses on to tell us what they see.
Yeah, absolutely. And oftentimes, as you said, we're that lens, for the pet parent.
I have developed some programs that are virtual for treating dogs that families either feel may have some physical pain issues, or they're getting to a certain stage in life where they probably would benefit from understanding whether there are changes they could make to the environment and those kinds of things. So I do have a few programs like that. And positive reinforcement or rewards-based doesn't obviously need to be using food. And so we do use whatever works with the dogs. You should be working with somebody who recognizes the behavioral signs that the dog is uncomfortable, even when there's food in the mix, right? Just because the dog is taking the food, you've got to look at the other signs. There's so much body language involved in that. And that's just so critical to really have that understanding. And also too, I think it's important to be a really kind person when you're working with clients who need your help, because your clients feel like they're being judged by their dog's behavior, right? And so I think I always send a message out to people who are coming to my classes, and I send messages to people that I'm doing myotherapy with, saying, hey, if your dog barks, that's okay. They're just using their voice. I'm okay with that. If your dog jumps up on me, is it okay with you? Because I can deal with it. It's so.
Sometimes the person that you're working with, you said earlier, you're trying to educate, they can't hear you because they are so distracted by what their dog is doing. So they're hyper vigilant. By the end of that 45-minute session or whatever, it's like, did they really learn anything? Because they were constantly, like, quiet, down, off.
Yeah. You know what I've started doing, Chris? I started bringing books to my appointments. I bring a variety of reading materials and I ask my client which one they would like.
Oh, nice.
I work with a lot with videos for people, and just to say, hey, this is what this is going to look like. This is what you can expect, or this is something you can do at home. And then they also don't feel like they have to remember everything. Then I do a lot of, don't worry, I'm telling you this, but you don't have to remember it. I'm going to send it to you written up, or I'm going to leave you with this handout and this will explain it to you.
I read, Lisa, either on your website or the Galen website, the value of a simple daily walk for your dog. Mm-hmm. Can you just touch on that?
First of all, there's a few things I wanted to say around walks with your dog. So please make sure that whatever equipment you're using, harness, collar, what have you, you've had that assessed by somebody who knows what they're doing. And because we don't want to encourage walks in a way that's going to cause more problems for your dog. We want less problems. So the benefit of the daily walk, in addition to us humans getting our exercise, is great for dogs because if we can do that, ideally, what I'm picturing is the dog is on a very long lead and able to move through spaces in a very comfortable way. I mean, I recommend to people, especially dogs who are recovering from something, to do short 5 to 10 minute walks several times a day. We don't want to see a situation where the dog's going for no walks every day, and then they're going for a 2-hour walk on Saturdays to make up for that. So I'm just adding some little bits to this. But the daily walk is it's a great opportunity for bonding. It's a great opportunity to just keep those joints moving, especially in our older dogs. That movement, those regular walks are beneficial from a sensory perspective. They're beneficial, if you're doing them appropriately and they're not in an area where they're all, stressed out, and we can, maintain some psychological and nervous system health. That's great. And also just keeping that blood flowing. And one of the things I'll encourage, while I still have a moment here, I'll encourage people to consider doing a little bit of warming up your dog before you take them for a walk. So one of the things I teach pet parents as well is how they can use a little bit of light effleurage to warm up their dog's limbs before they take them out for a walk. And that can really be helpful too, especially in our senior dogs.
Warm up, very beneficial.
I would say essentially 100% of everything that you discussed today aligns with all the things that Kathy and I believe, and other guests on the show and so forth. So it just is a beast by another name called Galen Myotherapy. Yeah. And as we're wrapping up, I'd also read something else that I just, and maybe you said this, but I just want to reiterate this as a closing point, that we often don't know our dogs have discomfort. And when they are painful, it does change their posture, their behavior, their appearance, their mobility. And we can just do so much with very little to impact all of those things in a positive way.
Lisa, could you let our audience know where can they find you?
Okay. So my website is the best place to find me. So it is www.kindercanine, KINDER, and the number 9.com. And my email is Lisa, LISA, @kindercanine.com. On my website is absolutely the best place to find me. So I am located in Canada, in Ontario, Canada, but my services are available from wherever anyone is in the world if they're interested in some virtual work. And I am, if you go onto the Galen Myotherapy site, which is the main site in the UK, I am listed there. I am the only Galen myotherapist listed in North America. So I think I'm actually the only one.
Wow.
Yeah, I think I'm actually the only one in this whole half of the world right now. There's a There are some veterinarians training South America right now. And I think there are some people, it's a huge endeavor to be certified as a Galen Myotherapist. It is no small feat. And it is an intensive thousands of hours of study and paperwork. And not to mention I did an in-person practicum in the UK to really learn hands-on from the best. So
that takes a lot of dedication.
Yeah, I think it's very large in the UK and Norway and other parts of Europe, Australia, New Zealand. It's growing very quickly in India. A lot of people start the program but don't finish it because it is very intense. And Julia has designed it that way for a reason, right?
Sure.
There's a lot to, this is somebody who really cares a lot about the health of dogs and wants to make sure that we're practicing safely and that we're well educated. And they also have a variety of short courses and certificates. So if somebody's maybe just interested in looking at how to do a posture assessment. Yeah. And again, you don't have to be a veterinarian to take this course. So it's nice that way too, that it is accessible to people and they are accredited, and the UK has accredited the program.
Lisa, thank you so much. I'm so glad we got introduced to Medco Vet. Yeah. I'm so excited that you were here today. As the final thing that I would like to say is I'm looking at your website and so much information there, and people should go there, and it's just a lot of great resources there. But my favorite thing is your statement of we work with our dogs, not on them, fostering trust, communication, and well-being. That is the heart of who Chris and I really are as well. So we really are kindred spirits.
Thanks so much for joining us on Petability.
Thank you for having me.
Hi, Petability fans. This is your host, Kathy Simons. Do you live with a blind or visually impaired dog? Don't let vision loss stand in the way of a full, joyful life. In my book, Blind Devotion, Enhancing the Lives of Blind and Visually Impaired Dogs, I share my expertise and passion to help pet owners like you navigate life with a blind dog. From adapting your home to building trust and confidence, this book is your go-to resource for ensuring your furry friend thrives. Your dog's vision may be limited, but their potential isn't. Empower your dog. Get Blind Devotion today at Amazon.com.